Hello and welcome everybody. Welcome to the Animal Eye Guy. Today we're going to be talking about a condition called spontaneous chronic corneal epithelial defects or non-healing ulcers. So an ulcer is a problem that involves the top surface of the eye, so the so-called cornea, and this particular type of ulcer only involves the outermost, so the most superficial part of the cornea. They typically happen spontaneously, so for no particular reason. In some cases, they can be triggered by things like trauma or rubbing at the eye or something like that. And then they refuse to heal for several days, weeks, in some cases even for several months. We usually see this in dogs which are about 6 to 8 years of age. However, there are some breeds where we might see it a bit sooner, such as in French bulldogs. So the exact reason why it occurs in dogs is not completely understood yet. There is, however, a very similar condition in humans, and in humans we know that the problem is caused by the different layers of the corneas not being well connected to each other, which is usually an age-related problem. And as soon as there's a small break in the top surface of the cornea, the surrounding part of the cornea will start to brittle off. We assume that the pathology is very similar in dogs. However, this has not been completely proven as it has been in humans. The problem that results from that is that there's a membrane that forms over the ulcer, which is similar to the skin on custard or on hot chocolate that will form, and it will stop the top surface of the cornea from healing in the natural way. So the goal of any sort of treatment is to try and get rid of that membrane. Usually we see these ulcers occurring in one eye. However, if they've had it in one eye, it's very likely that they're going to develop in the other eye at a later date. Any breed can get one of these ulcers. However, we do see this more frequently in boxers. We see very frequently in French bulldogs and other breeds such as West Highland White Terriers, as well as Staffordshire Bull Terriers. So there are a number of treatment options, all of which have their own advantages and disadvantages. One of the simplest and most commonly used treatments for this is a so-called corneal debridement. So some local anesthetic is applied in the consulting room, and a sterile cotton bud will be used to debride any loose top surface of the cornea, and to try and get rid of this membrane which has formed over the top of the ulcer. The success rate of this is roughly around 50 to 60%, so it's not a particularly high success rate, but it will sort most non-healing ulcers out, usually in the very early stages of the disease. There are other treatment options such as a so-called alga brush keratectomy or a diamond burr debridement, which can also be done conscious. It's similar to the debridement. However, the rotating tip, as you can see on this picture below, is more powerful at trying to get rid of this membrane, and we typically treat the entire cornea. And we would expect to see a success rate somewhere around the 70 to 90% success rate. On average, about 80% of cases we would expect to respond to this type of treatment. However, if it doesn't respond, it may need to be repeated or a different approach might need to be adopted. More invasive treatment options include things like grid keratotomies, where again we start off by taking all of the loose top surfaces of the cornea off, and we then use a very small needle to make some scratch marks into the cornea. That's typically in a grid-like fashion, hence the name. When done under an anesthetic and an operating microscope, we expect the success rate to be somewhere around 95 to 98%. Um, and then finally, the most successful but also most invasive treatment options is a so-called superficial keratectomy, as you can see on this picture below. Um, it's a very different approach in the sense that you don't debride the cornea. You take the top surface layer of the cornea off using a microsurgical scalpel blade, and then cause a slightly deeper ulcer. However, this deeper ulcer would expect to heal faster. However, it will come with some scar tissue formation. There are also a number of other treatment options, such as punctated keratotomies and thermokeratoplasties, as well as chemical ablations of the top surface of the cornea. Again, all of these treatment options are aimed to do the same thing, is to debride this membrane away and to give the cornea a fresh start to heal over. Well, if left untreated, these ulcers can remain for many, many months, sometimes even years. As long as you have an ulcer, it's a very good entry port for bacteria to get into the cornea. And once you have bacteria in the cornea, it usually starts the infection starts going deeper, and then you can end up in slightly bigger problems. Also, having an ulcer also means being painful in most cases, and having a painful eye for several months isn't an ethical approach. So hopefully you found this video useful. Please ask any questions below if there are any, and I'll see you next time.